Welcome to the deep dive. Today, we're taking a look at some really foundational psychological theories.
The ones that are just crucial for understanding mental health, right?
Exactly. We're using psychiatric mental health nursing, concepts of care in evidence-based practice as our main source material here.
It's a pretty comprehensive guide.
It is. And our mission really is to give you a clear, concise overview of these key frameworks. The idea is you'll get a richer sense of human behavior, different therapies.
Without getting lost in all the academic jargon, just the core ideas.
Precisely. It's amazing how many different angles there are when you try to understand the mind.
Oh, absolutely. It's incredibly complex. This book does a good job laying out the different perspectives.
Okay, so let's kick things off with Freud, psychoanalytic theory.
The classic starting point for many.
Right. He talked about personality having three parts. There's the id, that's all about immediate gratification, like, I want it now.
The impulsive part, yeah.
Then the ego, which is, the rational mediator trying to deal with reality.
Yeah.
And the superego. That's our moral conscience, our internal rule book.
And the conflict between these is key.
Totally. And to manage that conflict, that anxiety, we apparently use defense mechanisms, unconsciously.
Things like denial, projection, ways to protect the ego.
Yeah. So the therapy goal there is really about uncovering those hidden conflicts. Things like free association, dream analysis.
Bringing the unconscious to the conscious. It was such a revolutionary idea at the time.
It really was. That idea of a hidden part of yourself driving your behavior. It's quite something.
Definitely shifted how people thought about the mind.
Okay, moving on. Sullivan's interpersonal theory. This one's different.
Very different focus, yeah. It's all about relationships.
Exactly. He argued that our personality, and even mental disorders, develop through our interactions with others.
So anxiety, in his view, often stems from those social interactions. Feeling disapproved of, perhaps.
Right, and that anxiety then motivates how we behave with people. So therapy here focuses on improving communication, sorting out those interpersonal tangles.
It really highlights how fundamental connection is. When relationships are strained, it takes a toll.
It really does. Hits home how much our social world impacts our internal world.
Then you have the behavioral folk.
Ah, yes, the behaviorists. Bit more concrete, maybe. We've got Pavlov and classical conditioning.
Dogs in the bell, right.
Yeah.
Learning through association.
Yep. And then Skinner with operant conditioning. The idea that our behavior is shaped by consequences, rewards, punishments.
If an action leads to a good outcome, you're more likely to repeat it. Simple, but powerful.
And this leads directly to techniques like behavior modification, using positive reinforcement, for example.
A very practical approach. Focuses on observable actions.
And the intriguing bit, that behaviors aren't fixed. They can be learned, and importantly, unlearned.
Which offers a lot of hope for change, actually.
Okay, let's switch gears again. Cognitive theory. Beck is a big name here.
Right. This focuses squarely on our thoughts.
The link between how we think and how we feel. Beck noticed that people experiencing emotional distress often have these distorted ways of thinking, negative biases.
He called them cognitive distortions, things like catastrophizing or all-or-nothing thinking.
Exactly. So cognitive behavioral therapy, CBT, which is huge now.
Very widely used.
It grew out of this. It helps people identify those unhelpful, often automatic negative thoughts, and then challenge and change them.
It's about learning to question those thoughts, not just accept them. Builds resilience.
It's quite empowering, isn't it? The idea that changing your thinking can genuinely change your emotional state.
Definitely. Gives people tools they can use themselves.
Then we have the humanistic side of things. Bit more optimistic, maybe?
Often seen that way, yeah. Focuses on growth and potential.
You've got Maslow's hierarchy of needs, that pyramid showing our motivations, from basic survival up to self-actualization.
A framework for understanding what drives us.
And Carl Rogers' person-centered therapy. This really emphasizes the therapeutic relationship itself.
The therapist's role is key. Providing empathy, being genuine, offering unconditional positive regard.
Creating a safe space for the client to explore and grow. It really values the individual's own experience.
Yes, the focus is on fostering that inherent drive towards becoming your best self.
Okay, nearly there.
Yeah.
We also need to touch on biological theories.
Can't forget the brain and body, you know.
This perspective looks at the physiological roots, the genetics, how our biology influences mental health.
Neurotransmitters are a big part of this, the chemical messengers in the brain.
Right, like serotonin, dopamine.
Imbalances in these can affect mood, sleep, energy. So treatments often involve medication.
Pharmacological interventions aiming to correct those biochemical imbalances.
It's a vital reminder that mental health isn't just in the mind, so to speak. There's a physical basis too.
Absolutely. It's all interconnected mind and body.
So you can see how all these different theories, they give nurses, therapists, everyone in mental health a kind of toolkit. Different ways to understand what might be going on for someone. It informs how they assess a situation.
How they might intervene, what kind of therapy might fit, what coping strategies to teach.
Exactly. Let's take a quick example. Say you have a patient who avoids social events, feels really worthless.
Okay.
Well, using a cognitive lens, like CBT,
Right.
a nurse might help them spot the negative thoughts behind that. Maybe thoughts like, everyone will judge me, or I have nothing interesting to say.
And then help them challenge those thoughts.
Precisely. Gently question the evidence, look for alternative ways of thinking. The goal is to see if that changes the avoidance, if their self-perception starts to shift.
Makes sense. You're connecting the theory directly to the practice.
That's the idea.
So wrapping this up, the big takeaway is that these different psychological theories, they're not necessarily competing, but they offer diverse, essential frameworks, different lenses to view the complexities of mental health.
They all contribute something valuable to our understanding. And here's something for you, the listener, to think about. As you heard about these theories, psychoanalytic, interpersonal, behavioral, cognitive, humanistic, biological, did any particular perspective resonate more strongly with you?
That's interesting.
What does that preference perhaps tell you about your own underlying beliefs about why people think, feel, and act the way they do? Something to maybe explore a little further.